Okay, a lot of information to cover in this. This is supposedly the patient, Thomas Eric Duncan. I don't have Facebook, or I'd log in and see what's on there. But this is as much as I can get. There's the picture of the man. Alright, Hoax Online is, I figure, this is a really surprisingly good, in-depth article with a lot of information. So I'm going to go through it. Only parts of it. It's, like I said, it's very long. But let's see what we say here. Okay, 5 students attended 4 different Dallas schools this week after possibly being in close contact with the Ebola patient over the weekend. They live with him. The 5 students were in the same house. The Ebola patient named today Thomas Eric Duncan, who had traveled to the U.S. from Liberia on September 20th to visit family. Mr. Duncan, a Liberian national, quarantined at Texas Health Presbyterian Hospital since Sunday, the second time he went there. First time they turned him away. The children who came in contact with Mr. Duncan are showing no symptoms. They wouldn't yet, and are now being monitored at home, but they were in school all week. Schools are on high alert with additional health and custodial, where's your L, staff as an added precaution. Mr. Duncan arrived in the U.S. on September 19th, but he landed in Dallas on the 20th after flying from Liberia via Brussels in Belgium. Now, what it doesn't say there, and obviously it's for a reason, and I haven't seen this reported anywhere else either officially, there are no direct flights from Belgium to Dallas on Brussels Airlines, which is what he took. I'll show you that later in the video. I have the exact flight that he took. And there are no direct flights. They all stop in D.C. Every flight from Brussels Airlines stops in D.C. So keep going. He attended Texas Health Presbyterian on September 26th, but was dismissed with antibiotics and not asked details about his travel history. You'll see there's a conflict on that within this article itself. And it says he may have contracted Ebola while handling his landlord's seriously ill daughter. She died the next day. So he knew that he had contact with it when he came here. All right, school children in Dallas may be at risk from Ebola today after 5 children who attended 4 different Dallas schools came in close contact with Mr. Duncan. Close contact as in they lived in the house with him. Like I said, it's a long article. I'm going to skip around. His sister, Mai Wura, said her sick brother told officials the first time he went to Texas Presbyterian that he was visiting from a West African country in the so-called Ebola hot zone. So that contradicted the last bullet point right there in the 4th paragraph. Before he was sent home with antibiotics, a critical missed opportunity, intentional, to prevent others from being exposed to the disease. Dallas Independent School District Superintendent Mike Miles said on Wednesday, the children who came in contact with Mr. Duncan are showing no symptoms and are now being monitored at home. As an added precaution, Miles said additional health and custodial, here's your L, staff will be at the high, middle, and 2 elementary schools the children attended. Mr. Duncan's family are among up to 18 people being monitored after exposure to the man, along with the ambulance crew who transported him to the hospital. So if the CDC is only monitoring 18 people, they're obviously missing some folks. Dr. Mark Lester also confirmed that a nurse asked Mr. Duncan on his first visit whether he had been in an area infected by the Ebola outbreak that had killed thousands in West Africa, but that the information was not fully communicated throughout the whole team. Bull! Mr. Duncan underwent basic blood tests, but not an Ebola screening. Mr. Duncan is now in serious but stable condition and has been quarantined since Sunday, although he was in the U.S. for almost a week before being isolated. He is awake, talking, and asking for food, doctors said today. According to the New York Times, Mr. Duncan worked for a shipping company in the Liberian capital, Monrovia, but had recently quit his job and gotten a visa to come to the U.S. The Times also revealed that Mr. Duncan may contracted Ebola, while carrying his landlord's seriously ill daughter to hospital. She passed away from the virus the following day. The landlord's son and 2 neighbors who came in contact with the woman also died. The Liberian government said on Wednesday that the man showed no signs of fever or symptoms of the virus when he left Liberia for the United States via Brussels on September 19th. He obviously knew that he had come in contact with it. The patient showed no symptoms of the disease during his journey, which included a stop en route to Brussels, Belgium, and D.C. Belgium's health ministry said the U.S. experts had advised Brussels that the man was indeed not displaying symptoms, so he would not have been in a position to pass on the virus. Well, I'm glad the U.S. experts are telling Belgium what he was like when he was in Belgium. Spokesman said that Belgium therefore did not need to trace fellow passengers or crew of Brussels Airlines, one of the very few operators still flying to Guinea, Liberia, and Sierra Leone. What about casting that wide net, Mr. Friedman? In that press conference yesterday, he said you'd rather err on the side of caution, more people rather than less, but apparently not. Right, Mr. Duncan began to develop symptoms of Ebola on September 24th, 4 days after arriving in the U.S. He sought medical care on September 26th at the hospital, where he was sent home. On September 28th, Mr. Duncan was rushed to the hospital in an ambulance while vomiting and was quarantined. It raised the frightening prospect that he was mixing freely with others for a full 4 days while showing symptoms of the virus, the time when Ebola is most contagious. A team of CDC disease detectives arrived in Dallas on Wednesday and were going door to door to find out who may have come in contact with the man while he was contagious with Ebola. And just remember there what it says about him while he was in the ambulance. Right? I'll show you why later. Mother of three, Elizabeth Rayo, watched the victim being taken out of his flat and pushed on a gurney into the back of an ambulance. I could not see his face, but just saw the ambulance outside and he was being loaded in, she told Hoax Online. I know he lives in the same block as me, but I don't know his name. Alright, so this guy obviously wasn't just visiting. I know he lives in the same block as me, but I don't know his name. So he's been there before. She's seen him before, not just within the last couple days, apparently. Ms. Reyes said the residents had no idea at the time that the victim had the highly contagious disease. She did not see any health officials at the complex, which is mostly home to newly arrived immigrants from Africa and India. No one said anything to us. I only found out that this was the place when the media turned up. The 29-year-old who has lived at the Ivy Apartments for 2 years said, "Of course, I'm very worried. I have 3 children. If the man had Ebola, we should have been told. We should have been allowed to leave." And there, this timeline on the right, I'm not going to read it. You can read it for yourself there. Right, Dallas County Health Department was forced to deny that a second male patient was being closely monitored today after media reports. The ambulance crew who transported Mr. Duncan all tested negative for Ebola on Wednesday, but have been placed in reversed isolation at their homes for the next 21 days as a precaution. Of course they're going to test negative. It's only been a few days. Ambulance 37, which transported him to the hospital, has been cordoned off. There are concerns after it was used to move patients for 2 days after the Ebola patient, but hospital officials have reassured citizens that it was properly sterilized. Yeah, sure. The guy was vomiting all over that thing. You washed it out most likely. You didn't properly sterilize it. You didn't know he had Ebola. So for 2 days, whoever was in ambulance 37 should also be on that list of 18 people that are being monitored. The man arrived in the U.S., so we went over this already. En route, U.S. Mr. Duncan also traveled through Brussels in Belgium, the Liberian Ministry of Information confirmed today. There is believed to be no risk to anyone who traveled on the same flight from Liberia because he did not have symptoms at the time, so we're told. Health officials are investigating the misdiagnosis, and while the patient's isolation was delayed despite his symptoms and his travel history. A source told CNN that no one had asked Mr. Duncan if he had recently traveled. Another contradiction. You've gone back to the original last bullet point. You said you didn't ask, then you did ask, and now no one asked. So frustrating. Get your lies straight. Community leaders are also assisting medical professionals in the hunt for those who need to be tested while trying to quell panic in the local Dallas community. Stanley Gay, president of the Liberian Community Association of Dallas-Fort Worth, told Hoax Online on Wednesday that he believed Mr. Duncan was in his 50s. I believe that from the picture. He understood that the man had been visiting his wife or fiancée, and the house he had been staying in had a lot of children living there. Mr. Gay said at a community meeting on Tuesday, we've been telling people to to stay away from social gatherings, such as community meetings. God. We need to know who it is so that they, family members, can all go out and get tested. If they are aware, they should let us know. We are very concerned about it. Albin Tarty, spokesman for the association, said he was keen to avoid a panic, but that he wanted anyone infected to come forward. Mr. Tarty said it's scary for them. It's scary for everyone. All right, this here it was a sidebar. There's more to it, but it was irrelevant. This is about the ambulance crew. Dallas Fire Rescue Assistant Chief Norman Seals told Fox that his crew's quick thinking meant that precautions like gloves and masks were immediately put in place when they recognized the man's symptoms and found out his travel history. So according to this, the two ambulance technicians knew about his travel history, but yet the nurses didn't? Or they did? No, they didn't ask, but they did ask. Complete BS. The ambulance used by the fire station 37 crew has also been cordoned off, but there are concerns because it was used for 2 days after the patient was transported, but before Ebola was confirmed. Do you see what's going on here? They can't get their story straight because it's not true. And here's a picture of the ambulance from the article. If you notice in the bottom right-hand corner, all the photos in this article have that plus 13 there. I'm sure it's a coincidence that they all have 13 on it. And then gotta leave it to Hoax Online. How the U.S. woke up to virus threat, the Americans with Ebola. Though the nationality of the man being treated in Dallas, Texas, has not been publicly disclosed. What? 4 Americans made headlines after they contracted the Ebola virus in West Africa. 3 of those individuals have been released from the hospital. Then it goes on to show Brantley, Wright Bowl, and Seals, the other guy. I'm going to do maybe a video on this guy. He had a birthmark in the middle of his head in some of the pictures, and it's not there now. So I don't know if Ebola got rid of that for him or if they just picked a different picture to Photoshop when they did it earlier. But I might put that up later on. So here's, you can read this on your own, pause it, do whatever. Ebola, we all pretty much know this by now. And then the article continues. One of the health workers who contracted Ebola, Samaritan's Purse, Kent Brantley, testified to the Senate Health, Education, Labor, and Pensions Committee about the prevention methods earlier this month, the National Journal report. And you just gotta love the symbolism this guy uses. Many have used the analogy of a fire burning out of control to describe this unprecedented Ebola outbreak, Brantley said. Indeed, it is a fire. It is a fire straight from the pit of hell. Surprised he didn't say gate of hell. We cannot fool ourselves into thinking that the vast moat of the Atlantic will protect us from the flames of this fire. Who calls the Atlantic a moat? Indeed, we must mobilize the resources to keep entire nations from being reduced to ashes. You can't make this stuff up. And then, of course, who's got to stick his nose into it? One day before the Dallas Ebola case was publicly confirmed, Bill Gates said at a breakfast meeting that countries should get ready to handle a possible outbreak of the deadly virus as people from Liberia, Sierra Leone, and Guinea move across borders. Again, you can read the box on the right there. Look at that. Ugh, this kind of makes me sick. Bill Gates, Ebola could spread beyond West Africa. Billionaire and eugenicist Bill Gates has warned the countries should get ready to handle a possible outbreak of Ebola in case it spreads further as people from Liberia, Sierra Leone, and Guinea travel across borders. Remember, this is the day before. Because of that uncertainty, I'm not going to hazard a guess, Bill said after being asked whether he thinks the massive ramping up of international aid over the past few weeks is enough. The World Bank has started working with countries to develop plans should the highly infectious disease spread. The lesson so far is that countries with strong primary healthcare systems already in place are well positioned to halt the march of Ebola, as Nigeria and Senegal have demonstrated in their quick response to the cases there, Gates said. Bill and Melinda Gates Foundation funneled extra money in July and August towards Nigeria and pledged an additional $50 million on September 10th to fight the epidemic, which has so far infected over 6,000 people, mostly in Liberia, Sierra Leone, and Guinea. All right, that's it for the article here. Coming up next is the flight information that I was able to track down. And we'll see that here. It's the one above the highlighted mark. Sorry, I put the highlight on the wrong one there. So it's Roberts International, which is in Monrovia, to Brussels, A333. And since that date, on the 19th when it left Roberts International. It's had 7, I believe, 1, 2, 3, 4, 5, 6, 7, 8 other flights. So this plane has been around. So if what they're telling us is BS, and most of what they tell us is BS, then this plane is all over. But it looks to be going between the same destinations: Brussels and Dakar, Brussels and Liberia, Brussels and Dakar, Liberia and Dakar. So at least that's some kind of positive on this part of the journey. Now I'll show you moving forward that how it connects in Dallas, or in DC, excuse me. But first, here it is. It was identified as BEL 1247 aircraft A333 that left that Friday at 8:40 p.m. and arrived 5:15 a.m. Central on Saturday in Dallas. And I got this from FlightAware. Here you can see Brussels Airlines 1247, Roberts to Brussels, and all the information there. I'll put the links to all these, where I'm getting all this information from, in the description box. So here it is again, Monrovia to Dallas. This is the flight here. So if you click the I on the right, it pulls up this screen here. So you got Roberts to Brussels, and then a 6-hour, 45-minute layover in Brussels. Then you go from Brussels to DC, 2-hour, 45-minute layover in DC, and then from DC to Dallas-Fort Worth. So you'll see that there is only one flight that leaves on Friday and arrives on Saturday, which is what they're saying the patient did on the 19th and arrived on the 20th. So this is it. This is the one. Flight 333 SN 1247 is the airplane. So that's on that. And then just a quick thing to end here. The Ivy Apartments is where this guy was staying. They said he stayed on the first floor. Their apartment was on the first floor. And when I first heard apartments, I pictured some huge complex where he would have taken an elevator and walked around and all this stuff. But it looks like it just went straight to the door. So that's good at least. But coincidentally or not, that mark on the bottom right is where the apartments are. And then right in the middle of the screen is where the hospital is. Literally like a quarter mile away, or 600 meters away. So take that for what it's worth. So there you have it. The flight that the guy took, the apartment he stayed in, and a pretty detailed article from Hoax Online, even though there's a lot of contradictions in there and these people can't really get their story straight. So let's hope that it doesn't go any further and doesn't spread, but I'm not I guess I'm skeptical.